Have you ever caught yourself drifting slightly to one side while crossing a room you've walked through 1,000 times before? A shoulder that brushes the doorway for no clear reason. A small hesitation before your foot finds the floor, as if your body needed an extra half second to decide where straight ahead actually is. Most people notice it once, blame a worn rug or tired legs, and keep moving. But what if that small sideways pull has almost nothing to do with your legs at all? What if the real explanation is sitting several inches higher, in a part of the body almost nobody thinks to check? This is one of the most overlooked patterns in how people lose their sense of steadiness as they get older. It rarely begins as a dramatic fall. It begins quietly. A pause before stepping off a curb. A tighter grip on the handrail than you needed last year. A strange uncertainty turning around in a narrow hallway that used to feel completely automatic. Because it builds so gradually, almost nobody connects the dots until the pattern has been forming for years, hiding in plain sight. And when people finally do ask a doctor about it, the answers are often frustratingly general. Watch your step. Take it slow. It happens with age. None of that is necessarily wrong, but none of it explains the actual mechanism. And without understanding the mechanism, there's nothing specific to act on. So people go home, try a few generic leg exercises, and wonder why nothing changes. Picture a fairly ordinary moment. Standing up from a low couch, turning quickly because someone called your name, reaching into a cabinet just slightly above shoulder height. For one brief second, the room seems to tilt a fraction off true, and your hand shoots out toward the nearest solid surface, before your mind has even registered why. Most people file that moment away and forget it within minutes. But moments like that, repeated often enough over months, are usually the earliest version of the exact pattern this video is about, and they almost always arrive long before anyone would think to call it a balance problem. Here is the part that surprises most people the first time they hear it. The structure responsible for keeping you walking in a straight line isn't located in your legs, your hips, or your feet. It sits at the very base of your skull, tucked beneath the back of your brain, inside a dense, deeply folded structure called the cerebellum. The name comes from Latin for little brain, and despite making up roughly 1/10 of your brain's total volume, it contains the majority of your brain's neurons, more densely packed than almost anywhere else in the nervous system. The cerebellum's job is timing and coordination. Every second you're upright, it is quietly comparing 3 separate streams of information. What your eyes are seeing, what the vestibular organs in your inner ear are sensing about motion and head position, and what tiny pressure receptors in your joints, muscles, and the soles of your feet are reporting about where your body actually is in space. It blends all of that, almost instantly, into a stream of micro-corrections that keep you upright without you ever noticing the effort. When the system works well, walking feels automatic, almost thoughtless. The moment that input gets even slightly disrupted, the automatic feeling starts to crack. You feel less certain about where the ground is. You start scanning for something to hold on to before you've consciously decided you need it. This is the experience so many people describe as drifting, or feeling unsteady on their feet. And it's also one of the most searched, most misunderstood health concerns among adults over 50, because it rarely comes with an obvious cause. For decades, the conventional explanation has been simple and, frankly, a little dismissive. It's just age. Aging genuinely does affect how the balance system performs, but treating it as the whole story skips over something far more specific and far more workable. To understand what's actually happening, you have to look at how blood physically reaches the cerebellum, because it doesn't arrive through some separate protected route. It travels up through a pair of arteries called the vertebral arteries, which wind through a narrow chain of bony tunnels inside your cervical spine, the 7 vertebrae that make up your neck, before finally reaching the base of the brain. That pathway is elegant, but it is also exposed. The muscles surrounding your cervical spine, particularly the deep suboccipital muscles, tucked just beneath the skull, and the long diagonal muscle running from behind your ear down to your collarbone, sit extremely close to those arteries. When those muscles stay chronically tight, whether from years of forward head posture, an old whiplash injury, ongoing stress that causes the body to quietly brace itself, or simply hours each day spent looking down at a screen. They can place subtle, sustained pressure on the surrounding tissue. To be clear, this is not the kind of sudden blockage associated with a medical emergency, and any sudden onset of severe dizziness, slurred speech, facial drooping, or one-sided weakness should always be treated as urgent and evaluated immediately by a medical professional. What's being described here is something quieter and slower, a gradual narrowing of available blood flow that, over months and years, may leave the cerebellum working with a slightly reduced supply of oxygen and nutrients at exactly the moments it needs to fire those rapid balance corrections. Researchers who study circulation to the back of the brain have long noted how sensitive these posterior structures are, even to modest reductions in blood flow that wouldn't register as a problem anywhere else in the body. This is where modern daily life quietly works against us. Most adults now spend hours with their head tilted slightly forward toward a phone, a laptop, or a steering wheel. Physical therapists sometimes call the resulting posture pattern tech neck, and research on cervical spine mechanics shows that even a modest forward head tilt multiplies the load placed on the muscles supporting the back of the skull. Pair that with a largely sedentary lifestyle that rarely asks the neck to rotate fully, look upward, or turn quickly, and those muscles gradually adapt to staying short and tense, simply because that is the only position they are ever asked to hold. A few misconceptions tend to follow this topic everywhere it goes, and they're worth clearing up directly. One is the assumption that any unsteadiness must be an inner ear infection, something like vertigo, which is its own distinct condition with its own sudden spinning symptoms, rather than the slow, low-grade drift being described here. Another is the belief that resting more, moving less, and simply being cautious will protect an unsteady person, when in most cases the opposite is true, since reduced movement is exactly what allows balance pathways to weaken further. And a third is the idea that this has nothing to do with the neck at all, an assumption that persists mainly because so few people are ever shown the anatomy connecting the two. There's a second piece to this story, and it matters just as much as blood flow. Balance was never a single sense to begin with. It's a blend of three systems working in constant negotiation: vision, the vestibular organs of the inner ear, and proprioception, the dense network of sensors in your joints, muscles, and the soles of your feet that tells your brain exactly how your body is positioned, without you having to look. As people age, the vestibular hair cells responsible for detecting motion gradually decline in number. Proprioceptive sensitivity in the feet and ankles tends to dull, and the brain's ability to rapidly reweight information between these three systems, deciding in real time which sense to trust most, slows down. Scientists studying sensory integration sometimes call this slower reweighting one of the quiet, underappreciated hallmarks of aging balance systems. And like every neural pathway in the body, these systems follow a simple rule: use it or lose it. Most adult life happens on flat, predictable, well-lit surfaces. People rarely walk backward, rarely turn quickly without warning, rarely close their eyes while moving, rarely practice anything that genuinely challenges the balance system the way uneven trails or busy, unpredictable environments once did. Without consistent challenge, the brain has little reason to keep those balance processing pathways finely tuned. Combine a gradually narrowing blood supply to the cerebellum with a vestibular and proprioceptive system that has quietly gone underused, and you get exactly the pattern so many people describe: a subtle drift, a hesitation before each step, a growing reliance on walls and railings that weren't needed a few years earlier. A handful of ordinary daily habits tend to feed both halves of this problem at once, even though they rarely get mentioned together. Long stretches of sitting, whether at a desk or in a car, keep the neck locked in that same forward-leaning position for hours, while also giving the legs and feet almost nothing to balance against. Mild, chronic dehydration, far more common in older adults than most people assume, can affect circulation efficiency throughout the body, including the smaller vessels supplying the brain. and treadmill walking or laps around a flat, familiar block, while certainly better than no movement at all, simply doesn't ask the balance system to do anything it doesn't already know how to do, which means it can maintain fitness without meaningfully sharpening coordination. The consequences of this pattern reach well beyond the purely physical. Falls remain one of the leading causes of injury-related hospital visits among older adults, and the psychological side of this is just as significant as the physical side. The fear of falling can become almost as limiting as a fall itself. Many people who notice their balance slipping quietly begin avoiding situations that once felt completely ordinary. Walking outside alone, taking the stairs without a handrail in sight, standing on a step stool to reach a high shelf, chasing a grandchild around a backyard, or simply walking across an uneven parking lot without a second thought. That avoidance feels protective in the moment, but it tends to accelerate exactly the decline it's trying to prevent, because the less those balance pathways are challenged, the weaker and slower they become. It turns into a closed loop. Hesitation leads to avoidance, and avoidance leads to even more hesitation, often without the person ever realizing the loop has started, until independence itself starts to feel like something being slowly negotiated away rather than simply lived. Here is the part of the story that rarely gets told, and it's the part worth actually paying attention to. The cerebellum, along with the vestibular and proprioceptive systems feeding into it, remains remarkably capable of adapting throughout life. This capacity, known as neuroplasticity, is the same mechanism that allows a brain to relearn movement patterns after an injury or a stroke. It does not require youth to function. It requires consistent, specific, repeated input. Vestibular rehabilitation, an entire field of physical therapy built around this exact principle, has shown for decades that structured balance and gaze stabilization exercises can meaningfully improve steadiness, including in people who have lived with unsteady balance for years. Clinicians in this field often describe the goal not as eliminating every wobble, but as teaching the brain to recover from a wobble faster and more efficiently, which is a subtle but important distinction, since a small loss of balance is normal at any age. What separates a steady walker from an unsteady one is rarely the absence of small perturbations. It's how quickly and confidently the nervous system corrects for them. Which brings the conversation to the two things that actually deserve attention here, and notice that neither one is leg strength on its own. The first is reducing the chronic tension sitting on the vessels and nerves running through the neck. The second is deliberately re-engaging the balance pathways that a predictable, screen-heavy lifestyle has allowed to go quiet. Easing neck tension doesn't require anything aggressive or complicated. It typically involves slow, controlled rotation of the head through its full, comfortable range, a gentle, sustained stretch of that long diagonal muscle running from ear to collarbone, and patient, steady pressure applied with the fingertips along the base of the skull, where tension tends to concentrate the most. None of this should ever produce sharp pain, a pinching sensation, or tingling running down the arms. The goal is a mild, releasing stretch, repeated consistently, so the soft tissue surrounding those arteries has room to soften rather than staying perpetually braced. Re-engaging the balance system works on a different principle entirely. It's about deliberately recreating the kind of sensory challenge that everyday, predictable walking no longer provides. In practice, that can look like walking at a deliberately slow, exaggerated pace. Slow enough that the brain is forced to consciously process every shift of weight instead of coasting on autopilot. It can look like placing one foot directly in front of the other, along a narrow, careful line, essentially practicing the precise skill that prevents stumbles in tight hallways or crowded spaces. It can involve small marching movements that bring the opposite hand toward the opposite knee, a cross-body pattern that specifically activates communication between the two hemispheres of the brain. And it can involve practicing a controlled turn while keeping the eyes locked on a single fixed point, training the exact coordination between the eyes and the inner ear that tends to break down first, in people who describe feeling dizzy or disoriented while pivoting in the kitchen or turning to answer the phone. Even something as simple as slowly shifting your weight from side to side, then forward onto the balls of your feet, then back onto your heels, while holding lightly onto a sturdy chair or counter, trains your body's ability to catch itself in whichever direction a stumble actually happens. Real-world falls rarely occur in a straight line. They tend to happen sideways, while reaching for something, or while turning, which are exactly the directions most people never deliberately practice. None of this should ever feel like pushing through pain or genuine dizziness. If a movement produces a spinning sensation, sharp discomfort, or any symptom that feels meaningfully different from a normal, mild stretch, that's a clear signal to stop and check in with a physician or a licensed physical therapist, particularly for anyone with a diagnosed vascular condition, a history of stroke, or significant cervical spine issues. Balance training tends to be most effective and safest when it's practiced near something sturdy to hold on to, on a stable, well-lit surface, and at a pace the body genuinely agrees with, rather than the pace the mind thinks it should be capable of. What research on neuroplasticity consistently shows is that frequency tends to matter more than intensity. A few focused minutes practiced daily reshapes neural pathways far more reliably than one long, ambitious session attempted occasionally and then abandoned. This is partly physiological, since repeated, spaced-out practice is how the brain consolidates new motor patterns into something automatic, and partly psychological, since short, achievable daily habits are far easier to sustain than demanding routines that quietly get dropped after the first hard week. There's something worth sitting with in all of this. The drift you may have noticed in your own walking isn't necessarily a sign that your body is failing you. It's information. It's your nervous system reporting, quite specifically, where its sensory input has gone quiet, and where the blood supply feeding one of its most important coordination centers has gotten a little tighter than it should be. That is a fundamentally different story than simply getting old, and it's a far more useful one, because information you actually understand is information you can respond to, rather than something you're left to simply accept. It also helps to remember that nothing about this happened overnight, which means nothing about it needs to be solved overnight either. The tension sitting in the back of the neck built up gradually, posture habit by posture habit, screen hour by screen hour, over years rather than weeks. The balance pathways that have gone quiet didn't go quiet in a single afternoon. They went quiet through thousands of ordinary days spent on flat floors and familiar routes. A nervous system that adapted slowly in one direction is fully capable of adapting slowly back in the other. And the people who notice real change tend to be the ones who stopped expecting a dramatic before and after and simply kept showing up, a little, consistently, long after the novelty of trying something new had worn off. Somewhere between the tension sitting in the back of the neck and the balance signals the brain has quietly stopped practicing, there's a version of walking that feels less like managing a risk and more like simply moving through your day without a second thought. Most people never go looking for it, not because it isn't there, but because nobody ever told them where to look or what it had to do with their neck in the first place. So maybe the real question isn't whether your body is slowing down. Maybe it's whether you've been listening to the right part of it all along, and whether the next time you catch yourself drifting toward a wall, you'll finally know exactly what that small, quiet signal is actually trying to tell you.